I salute you, Sir Aaron. Wherever you're reaching us from, put in the chat box in the comment section. Let us know where you are reaching us from. Great. All right, welcome every single one of you. My name is Dr. Albert Sado here. I am your humble host for the Weekend Health Talk. And today, just as we are all aware, we are in the month of October, which is the Pink October, which is dedicated to creating globally breast cancer awareness. All right. The truth is, nobody wants any female or male to have a breast cancer that will warrant treatment. All right. Nobody wants that. We, as doctors, as medics, we all want earliest detection and care, so that what best options are available is given you. We don't want any advanced staging of any of complicated cancer or something. So awareness creation is very important. And today, I am privileged to have a specialist surgeon, a brother, a friend, working in the surgical department of Kolebu Teaching Hospital, Dr. Michael Kwaponya, who's going to take us through breast lumps, signs and symptoms that suggest what? Some of the things you don't have to worry about them. What do they suggest? He's here to share all that with us. After we are done, you have an option to ask all questions that may be bothering you. All right, now, if you join us late, the recording will be made available on the YouTube channel. So no worries at all. Thank you very much. Dr. Michael, please, over to you.
All right. Thank you very much, Dr. Albert Sedu here, and I'm very happy and pleased to be here. Please, if you can hear me, type a Y, just so that I know I'm not talking to myself. If you can hear me, type a Y. If you can hear me, type a Y. If you can hear me, type a nice. Everybody can hear me. That's a beautiful thing. All right. So, like Dr. Sadonia said, today we'll be talking about breast lumps. Some concerning, others to really not so much concerning. And it's become important because over the past few years, it's become very common because of proper detection methods or advancements in detection methods of breast lumps, especially those that can be very, very devastating. Devastating because once you get this kind of breast lump, I mean the cancerous ones, it not really affects you, it affects the people who depend on you, the people who take care of you, and the people who depend on the people who take care of you. So it's more of a community disease, not just a single person's disease. And it affects even your work and then the people at your work, especially if you're an employer or even if you're an employee, because then productivity is reduced because of your absence or because you are not available to contribute to whatever it's being done. So it's important that we look at breast lumps, more so in this month of October, which is the Breast Cancer Awareness Month. So then we'll look at a few of these lumps, some of which are cancerous, others are not cancerous, and then see what we can do, and then see which ones we should pay attention to and which ones we can safely observe over a period. All right. So my name is Dr. Nyako, and I'll be taking us through this. And this is how we are going to look at it. What is the breast and what it does, what lumps there are that affect the breast, and any risk factors for these things. And then are there any screening methods or any tests that you can do to find these things, various treatments, and then follow up if you find any of these lumps, or if you've had any treatment for any of these lumps. All right. So that's how we are going to go. Now, for me, I think the breast, it's a very nice organ. I mean, I'm sure most everybody will agree with me for the fact that one, it's a beautiful piece of organ, right? And it's one of the things that allows us to sexually relate to the opposite sex. Really, I think it's a beautiful organ, really beautiful, and then it has other functions too. One, apart from helping the woman with her sexuality and her self-esteem, it's also an organ for the baby. All right, it's an avenue, a conduit for nutrition for the baby, and it's one of the safest because it has a lot of nutrients. It has a lot of um, disease-fighting substances called immunoglobulins that are present, and all these things are good for the baby. And also, it's a toy for the man. I mean, depending on how you look at it, the breast is a very it's a very good organ. Beautiful as it is, it has all these functions. Being the toy for the man, being something that is used for sexual attraction and sexual intimacy, and being something for confidence for the woman, and also something that the baby latches onto for feeding. All right, so it's a very important part of the human body. And as you can see, the breast is made up of just a minute, I'll just get the pointer and then show you a few things. Okay, so I hope you can see the pointer. So this is the pointer. Now this is the breast tissue. These round things, the breast tissue, and then they pass through ducts to get to the nipple, where they come out of the human body. So this is where the milk is produced, and then they pass through all these ducts and then come out through the nipple. Around it are fat cells. So you realize people who have much bigger breasts would have more fat cells than those who have maybe the smaller sized breast. And it doesn't matter. Every breast size, from a size A to a size F, or cup size A to a cup size F or H, everyone is fit for purpose. Everyone can do the things that it's supposed to do. People are attracted to different breast sizes. Others to different breast sizes too can produce milk when the time is right for milk production. So this is the breast, and it's lying on the chest wall. So that's a muscle right underneath the breast proper, and then these are the ribs over which the breast lies. So then it's a very important organ of the human body. And just like most other organs, things that affect it can affect various other parts of the body. And these are just a few of the things that can affect the breast. Now, when we say something is benign, it means it's something that is not cancerous, or it's something that can be treated, and by and large, everybody will be fine. Okay. And most of the things that affect the breast are benign. 80% of the conditions that affect the breast are benign. And then 20% of them can be cancerous. Now, I showed some 3 pictures here. Now, the very first one, this one, it's a picture of a breast cancer in a man. I'm sure quite a number of us may not know that men too can get breast cancer, but it's possible. And it's even though it's rare, it's something that happens. So men too can get breast cancer, and usually this is how it looks like: a male breast cancer. And then on the right of that, it's an adolescent who is having some breast enlargement, sort of. All right, we call that gynecomastia. All right, so some breast enlargements can also happen in men, especially during the time of puberty, adolescence. Men see that. And then in some other conditions, maybe people who have liver conditions, chronic liver conditions, or some kinds of testicular tumors or testicular cancers, they can develop gynecomastia. By and large, most of the gynecomastia that happens is because maybe the man has put on quite some amount of weight, or the person is taking certain medications, or the person is maybe an adolescent, and it usually happens in young boys. I don't know how many men on the call I mean, whilst we're young, developed something like that. Really, it's common, and it shouldn't be anything of worry. Now, another thing too that happens is something we call galactose. Usually, it happens in people who are breastfeeding. So then you find a lump of sorts, but then that one, it contains milk. Right, a fairly roundish mass which contains milk, and you can have bells also happening in the breast. A ball can happen in the armpit, it can happen in the breast. So the breast is an organ. It usually stretches. It stretches from above, just below the clavicle, right down to somewhere around here, and then it extends into the armpit. So then anything that happens all around this area can affect the breast. All right. So you can have a ball here. You can have a ball here on the breast itself. You can have a ball here going into the axillary tail, or the part of the breast in the going into the armpit. Now these are just pictures of some of these benign lumps in the breast. Usually, the commonest, or by far one of the most common swellings in the breast, is a fibroadenoma. Usually, you see these ones in fairly younger women, in the ages of 20 to 25, or 20 to 30. It can even come as low as 16, 17. This is a fibroadenoma, and you can see it. This swelling right here, and it's a well encapsulated mass. Really, it's not hard, it's not rubbery. Sometimes it can get painful, but as its name suggests, a fibroadenoma, and a fibroadenoma, it's a benign mass. It is not something that is scary, because it can be taken care of, and chances are that it probably will not even recur. And depending on the size, it can be left alone, really, and nothing. It can either disappear, or it can get larger. It can stay the same way it is. Other times, you can have cysts. There are some women who have some kind of breast, lumpy breast. So you touch the breast at any point in time, and then it feels like there are small lumps in the breast. That's also usually a normal variant of the normal breasts. So you can have some of these cysts, quite a number of them, plenty of them in the breasts, and you have so usually call it fibrocystic disease of the breast. So then the breast feels lumpy, and it depends on how you touch the breast. If you touch the breast like how you squeeze bread, or bull fruit, I mean what we call here bull fruit, I mean you always feel a lump inside, and it's usually the breast tissue that you are feeling. But then as you go on, you realize that to touch the breast, you need the flat of your palm. That way, you don't feel this breast tissue. That if there's any mass in there, or any lesion in there, like the fibroadenoma or the cyst, you can feel it. So then you see, this is a fibroadenoma. It's really not something to be scared about, or something to be too much worried about. And usually they come very small, firm, round, and then they are very smooth. Sometimes they can be painful, especially right before the period. And depending on the size and then what you want, I mean, as per discussion with your doctor, it can either be removed or it can be observed. All right. So it's not something to be scared about. Now, this picture here is a picture of a swelling in the breast, but this swelling is a boil of sorts. It's a breast abscess, a boil. So you can see this area is different from this area. And usually the boils are very painful. The boils are very painful, and then they are shiny with some redness or skin changes around it. All these things are called signs of inflammation. And anytime you hear anything itis, there is inflammation. So you can say that when there's mastitis, there's inflammation of the breast. When there's pocketitis, there's inflammation of the pockets. I mean, in very trying economic times, pocketitis is very common. All right. So this one is something that happens, and it can be very painful. And usually, breast abscesses happen around the time of breastfeeding, or when you have someone suckling on your breast for a very long time, or frequently. Then you have germs traveling from the person's mouth through the openings in the nipple, and then it can find their way into the breast tissue and then form this ball. So then it's important that we maintain good hygienic practices, especially when we are getting the breast into the mouth. It's important. Otherwise, you can have germs tracking through the nipple and then getting into the breast. Then again, it also depends on the immune status of the woman. If she is fairly well immunocompetent, or she can actually handle some of these small bugs, and then they won't be able to cause full-blown infection or full-blown balls. And this one, this picture here, you can see that the skin is dimpled over here. You can see that same dimpling over here, and then you can see over here dots on the breast tissue, like the orange peel or the skin of the orange. Now, all these are signs of possible cancer. When the skin of the breast becomes something like this, when you feel a mass, and usually the cancer is not painful. Most of the time, it's not painful. If it gets painful, then it's getting far, or it's getting advanced. Most of the time, cancers of the breast are not painful, and they are usually hard masses. So then, because they are not painful and then they are hard and you're not feeling anything, we usually tend to ignore, and that's where the problem is. If you ignore it, then you're giving it time to grow. You're giving it time to keep increasing in size. So that's what it is. Breast cancers usually are not painful, and we usually find a mass that will either change the contour of the breast, or you find two breasts, or your two breasts, one will be of a different size than the other. So then the sizes will be different. The nipple, one will be looking somewhere, one will be looking at the original place, or it may even be like the nipple is drawn in. It doesn't mean that there are people who naturally have indrawn nipples, and that is a normal variant of the nipples. But if you are a kind of person who has, or if you have your nipples are out, but then of a sudden or over a period of time, see that it keeps drawing in, one of them keeps drawing in, then it's something that should be a cause of concern for you to see your doctor. It's important. Now, someone asked, what is the cause of cancer? And for most cancers, there really is no cause. A few of them you can pinpoint a cause, like cervical cancer. They are related to a virus, human papilloma virus, HPV, hepatitis B. You can find hepatitis B being a cause of liver cancer, chronic hepatitis B, or hepatitis C being a cause of liver cancer. But then most other cancers, there are things that make you more susceptible to developing a cancer or causing changes in your body that would make you develop a cancer. And these are the risk factors. It doesn't mean that the presence of the risk factors will automatically give you a cancer. It also doesn't mean that the absence of the risk factors also automatically excludes you from cancer. All it means is that once you have these risk factors, it increases your chances of getting the cancer. Once you do not have these risk factors, your chances of getting the cancers are diminished. But then again, there are other things, genetic predisposition. So then people who've had family relations who had the disease or who had the condition also have an increased risk. So then they are recognized cancer syndromes. And one of them is BRCA, or breast cancer syndrome, the BRCA genes. So usually when you have these in the family, it affects the members of the family, especially it doesn't matter whether you're a male or a female, but usually comes on at a younger age. Most cancers would happen after the age of 40 or after 50 years, because then you'd have given the tissue enough time to misbehave as it is. So then, with regards to breast cancer specifically, gender plays a very important role being a female increases your risk of breast cancer just because you have increased amount of breast tissue. So then the incidence in breast cancer in females is higher. And also because you are growing older, it is also a risk factor. As you are growing older, your defenses wane, and then you'd have even given time for any aberrations in the body to take seat. Then these things can show up. Genetic factors, like I said already, if it's in the family, it can show up in any member of the family. And it's more so if it's a first degree relative who was affected. So that's a mother, a father, or a cousin, or maybe a maternal auntie or a maternal, yes, a maternal auntie or a grandmother, paternal auntie or a grandmother. I mean, all these first degree relatives. Now, something called early menarche. Early menarche is how early you saw your menses. And usually before 12 years of age, when you see your menses before that time, it means your body gets exposed to the hormones for a very long time, early menarche and then late menopause. So around 55 years of age, you should have stopped menstruating. And quite a number of people start menstruating around 14, 15 years. Others get it before 12 years. So if you are, the risk is increased if you start menstruating very early and then menopause also it's very much delayed. Then it means your breast has gotten enough time or contact with the hormones that regulate the growth. And once you have a lot of time for the hormones to act on your breast like that, then possible that aberrations in the breast can happen. All right. And also people who for some reason, maybe they had a condition that necessitated a lot of radiation exposure to the chest, they also are at increased risk of developing not just breast cancer, lots of other cancers in the irradiated area. Now, there are other things that also protect against breast cancer, having children. But then the timing of the having of the children is important. Having children early is protective. And more so, breastfeeding the child is also very protective. Why? Because then the breast is giving a break from estrogen, and then progesterone is sort of relaxing the breast. So pregnancy is a protective factor, and then breastfeeding is also a protective factor. Now, breastfeeding, the one we talk about, is the one the baby latches on the breast and then suckles on the mother's breast so that, I mean, the baby gets fed. Not the one that the man does for pleasure or the woman gets for pleasure. That one, it can give you other benefits and not necessarily reduce your risk of breast cancer. So then having children early, it's a protective thing. Then it means that giving birth at an older age, beyond 35 years, will also be a risk factor. Then it means you haven't given your breast enough time to rest off the estrogen hormone, and they're not breastfeeding at all. I mean, we're in a very busy world. So people after birth, 2-3 months, then breastfeeding is ceased because we have to get back to work. 3 months, 4 months, it's advised that you should give your child, if nothing at all, at least a year of breast milk. So then your breast is protected from the effects of the estrogen. Also, hormone replacement therapy as we age and during the periods of menopause, because of the imbalances in the hormones, certain physiological things happen. Your mood swings, they tend to have vaginal dryness, painful sexual relations. Now, all these things, sometimes hormonal therapy helps some of these things, but then it also increases your risk of breast cancer during the time that you are using it. But once you stop it, then the risk wanes. And it's seen that obesity is something that affects not just the breast, but almost every other system: diabetes, hypertension, almost every other cancer that you can think about. You are sure that obesity will be a risk factor. So then obesity largely was simply having more weight than your body can handle. Okay. So then there's a way to check it. And once you're found to be overweight or obese, then it means that there's something that you should be able to do, or you should do, to bring your weight to an acceptable level. And lack of exercise, and they all go hand in hand. The more you don't exercise, the more you put on weight. And the more you put on weight, the difficult it is for you to move, because you feel tired easily when you start to move. All right. So it's all there. And it's, like I said, exercising, maintaining a healthy weight, and then limiting alcohol intake. All these are important preventive methods. And then having children at an early age and breastfeeding them while at it. So then for me, it's about, at least if you don't breastfeed at all, a year. And it's better if it's up to 2 years of age. Then you know that the breasts have gotten enough protection from it. All right. So that's by way of risk factors, especially for breast cancer. Now, for the other ones, the benign lumps, usually you don't find any risk factors. They just develop by themselves. And like I was saying, maybe a fibroadenoma, because you are developing, then a part of the breast, you just find a lump in there, and then you can send it, and then they take a look, and whatever can be done is done to it. Most of them, you don't usually have any specific risk factors. They either can be because of disorders in the breast development, or disorders in the breast involution, or as it is, the breast growing old. All right. Now, breast cancer is important. So it's important that we're able to find it and then detect it early. Now, the reason for doing all these things is so that you know what your normal feels like. And then if you have any abnormalities present, you can promptly recognize it. That's the whole essence, or that's one of the major reasons why we do the self-breast exam. So if you are a woman, or for a man, it's easy to know your breast. I mean, that's what it is. It's something small over there. You can press it, and then, I mean, or you can touch it, and if there's anything inside, it's easy to find a lump in a man's breast than in a woman who has a lot more breast tissue. But it's important that we pay attention to some of these signs. Sometimes the nipple changes. You can have a rash on the nipple, or like I said earlier, the nipple will be drawn inwards. And it can be something of concern. So you should see a healthcare professional to have it evaluated for you. Naturally or normally, you shouldn't have bloody discharge coming out of your nipples. If your nipples are untouched, nothing should come out of it. All right. So then you shouldn't have any milk coming out, any greenish discharge coming out, any yellowish discharge coming out. Not to even talk of bloody discharge. I mean, there are some people who just keep squeezing the breast just to find out if any discharge will come. I mean, that's not what you're talking. These are talking about spontaneous discharges. But then if during your examination of your breast, you try to express and then you find a bloody discharge, then it's something that should be seen by a professional. And then also a lump in the breast. And once the lump comes, it can change the symmetry of the breast. So one breast may look bigger. You may see a swelling. You may see that the skin over there is dimpled or is drawn inwards. Or you can see that one breast is heavier. Or you can see the orange peel appear. And sometimes you may not even feel any lump at all. All you see is the pitting of the breast skin or dimpling of the breast, of like what I showed you earlier, like the orange peel, this one. This all you may feel or you may see in the breast. Now, this one too is something that you should take to see the health professional. Then again, the breast can also change in color. A portion of the breast can have a different color. I'm not talking about the nipple areolar complex, which is usually darker in color than the rest of the breast, but any other area of the breast that you see that the color has changed, it can be reddened, it can be darker, and with an underlying mass or hardness, it's something that you should pay attention to. And then especially if you are postmenopausal and then you start having breast or nipple pain, sometimes during or around the time of menses, women experience breast or nipple pain or some tenderness in the breast. Now, this one, it's usually normal, and it subsides after the menstruation or even ovulation. I'm not talking about that kind of tenderness. Usually, especially for the postmenopausal women or the women after menopause, having pain in the breast for no apparent reason, it's something that maybe you should pay attention to, and then get it checked out. So then it's, I mean, with all these things in mind, um, once you're touching your breast to know the normal, so that if any of these changes happen, you can probably recognize them and then seek help, because treatment is available for most every lump in the breast. All right, treatment is available, and as part of means to detect breast lumps, there are screening methods and other tests that are available to help find these things. And one of the screening methods is the self-breast exam. You examining your breast and then finding out if there's any change that has happened in the breast. And then a clinical breast exam is when you bring it for a health professional to take a look, paying attention to areas that you most likely find lumps. And of course, you can have ultrasound scan done on the breast and then a mammogram. Now, this is a picture of a woman undergoing a mammogram of the breast, and this is how the pictures look like. And if there's anything in the breast that is of concern, it is picked up, and then if it needs to be properly characterized, a biopsy is done on it. A biopsy is just taking a bit of the tissue for more tests to be done on it to find what kind of lesion it is. And these are the things that are done. So the person is first examined, and then a scan is done, and then we see. Once we find it, some are easier to touch, others are much more difficult to feel. So then the scan to bring them to light. And then once we find these things, if any of them are suspicious, then we do a biopsy on them, or we take some for further tests to better characterize them. Now, if it's cancer, then there's a modality for treatment. If it's not, then there's also another modality for treatment. And basically, the modalities of treatment would either fall in any of these, a combination of these. So for most of the benign ones, or for the ones which are not so serious, active observation can be done, especially for the very small ones. So if there's a very small cyst, or there's a very small fibroadenoma in the breast, a very small lump in the breast, and then you have seen your doctor, and then your doctor has confirmed it is not a cancer, and it's very small. Sometimes chasing after it can even cause more harm to the breast than just letting it be and examining it to see if it will change characteristics or it will increase in size. So then it has a place, active observation. But for peace of mind, most people would want any lump they find in their breast removed, and that's fair enough. So you can have all these things also removed. Now, when it comes to cancer, the much dreaded treatment is chemotherapy, because of the effect it has on other tissues of the body. And yes, it can be very hard on the patient, but it's a necessary evil, as you may consider. It's very necessary to help kill the breast cancer, or the cancer in the body. And usually, once you detect a lump in the or a breast cancer, chances are that you have small spreads in the blood that have not taken seed yet. So then chemotherapy helps kill all these ones. And a number of times, not all of them even are able to get killed or are killed. So then it's important that a combination of drugs are used, and then a combination of modalities are also used. So then for people who have breast cancer, surgery is one of the mainstay treatments. And with surgery, if it's detected early, there can be surgery to conserve the breast. So then not every part of the breast will be taken off. It will just be the area with the cancer and some a bit of normal tissue around it, and you can still have your breasts back. Then again, there's still modalities for improving your breast size or the breast contours with breast reconstruction. Then there's radiation therapy, just to prevent recurrence at the site, so that you don't have the breast coming back again. And then there's hormonal treatment. Certain breast cancers usually elaborate certain hormones or hormone receptors, as it is. So that means that you can use certain medications to help control the growth or to help control the spread if it has already spread. If it has already spread, and all these things are available. And then there are other targeted treatment based on the biology of the cancer. And then there's also something called palliative treatment. And palliative treatment is usually for those who have had the breast cancer spread already, or very advanced breast cancer. Then with that one, you won't have surgery giving you a chance of cure, or the chemotherapy giving you a chance of cure. So then what is done is the best minimal intervention that would make your life comfortable. That's palliative treatment. So if you're in pain, you are giving something to control the pain. If the breast responds to some of these hormone treatments, then you are giving these treatments so that it stops or it halts the spreading. It probably may not reverse it, but it will overall improve your life so that you can enjoy the days with family and people who mean a lot to you. And that's what palliative treatment is. Now, it's important that we find ways and means to reduce the risk. And then once we have found anything, we see the people who are experienced enough to evaluate it. And then after treatment, we go on with our scheduled visits. Now, reducing your risk of breast cancer. Breastfeeding is one of the best ways of reducing your risk of breast cancer, especially if you're a man. Well, I mean, especially if you're a woman. A man cannot breastfeed. We are not engineered to produce breast milk and then breastfeed. But the woman was made for the woman's breast. Was specially made so that, I mean, after pregnancy, you can breastfeed. So the longer you breastfeed, the better it is for your breasts. So breastfeeding is one of the main things of reducing your risk of developing a breast cancer. It can't be gainsaid. Exercise, maintaining a healthy weight, limiting alcohol intake, all these things are very, very, very important. They are very important, not just for your breast health, but your overall health. And then your scheduled visits with your caregiver. If you've had treatment already, it's important. If you've had treatment already, it's not like because you've had the cancer removed, then you'll be lost to follow up, or you are going to seek other alternative treatment. Most of the time, people who seek alternative treatment come back with more disseminated disease in the breast and even in other parts of the body. So it's important. I mean, there are certain laid down protocols. If it's been detected that it's cancer, it's just it just makes sense to follow the one who is experienced in trade to give you advice on the way forward. All right, and it's important. That's how the self-breast exam is done. At least this month, I'm sure most of us have seen a lot of these things. This is just going to be a reminder, and you can do it in one of several ways. Maybe one of these three ways: either standing in front of a mirror or standing in the bathroom with soap on the breast, so that your fingers can slip over. And like how she has placed her hands, not forming a claw out of the hand, but the flat of the hand. You either move your fingers up and down in a vertical motion or in circles, and making sure to go over all the areas of the breast and even the nipple areola complex, and getting all the way into the armpits, because sometimes you may not have it in the breast tissue itself here, but you can find it in the armpit, and sometimes you can even find certain swellings in the armpit itself, not just in the axillary tail of the breast, but in the armpit itself. And you may not find anything in the breast, and the things in the armpit can point to something more sinister that is happening. So it's important, if you find any lump in the armpits or in the breast, you need to get it. You need to get it checked. And there's also for most people want to find out, will taking supplements prevent the breast cancer, or will it help cure my breast cancer? Now, it's important for us to know that one of the ways of treating breast cancers is chemotherapy and then radiotherapy. Now, all these things, the way they work, they try to damage the cells by producing something called oxidative stress in the body. Now, most of these supplements, and I'll talk to you about one of them, prevent oxidative stress. So it is really not advisable, especially for somebody who is undergoing breast cancer treatment, to be taking supplements that are rich in these antioxidants. Now, when you can take these supplements, it's one, when you don't have an established breast cancer, then I mean that's one point you can take. At one point you can take them. That means you're helping your body protect itself against some of these oxidative stresses that can cause DNA damages. So then it's important right now that you don't have any breast cancer, or you've not found any breast lesion. This is the most appropriate time to be taking some of these supplements if you have, or if you want. And they help because it's not just for cancers. I mean, the overall health of the person. And then also at a point when you're undergoing palliative treatment, like I said, most of the time when cancer is detected, some of them are already in the system, floating around. And so if you give your body anything that would sort of strengthen, let me put it like this, if you give anything that sort of strengthen the cells, the cancer cells can also pick it up and then also strengthen themselves, and then it would help prevent, or to help hamper cure. So at a point when you're having palliative care, then I mean, you need all the strength you can master, you need all the energy you can gather. So then you can use them during these periods too. But then if you're undergoing breast cancer treatment or breast cancer therapy, it's really not advisable to be taking these things, because they may affect the treatment that you're undergoing. And one of the things, the ones I like, is longevity. Because of how it works, it's one of the most potent antioxidants. So for anybody who doesn't have a recognized breast cancer yet, I mean, this is a product you can have as a go-to product, all right, to help prevent the oxidative stress that may cause DNA damages in your body, and then give you any of these illnesses that you are not really ready for. So it's very, very important. And for people who are down, or who are undergoing palliative treatment, this is something that can give them energy on the go, less aches, more strength to go about their day. So it's very, very important. The caveat is that it won't be advisable to use them during breast cancer treatment. All right. So my final words before any questions, and is that most of the lumps that you find in your breasts, or you find in the breast, 80% are benign, and 20% are cancerous. And it is this 20% that can be very devastating. So it's important not to take chances. It's important not to take chances. Once you notice any lump in the breast, it's important to get it checked and make sure that it is not anything cancerous. If it is cancerous, it's not the end of the world. There's still treatment, and then we can still continue and then live life after treatment. All right. So thank you very much. And if there are any questions, I'll be glad to take them. Dr. Sedo here.
Thank you very much, Dr. Michael, for such of course, obviously, we all realize that there is so much to talk about when it comes to the breast. Yes. All right. So thank you very much, Dr. Michael. It's good to always hear from the expert. Now, the floor is now open for the next few minutes. If you ask any question regarding breast, everything that Dr. Michael has talked about, so put a question in the chat box. Type your question in a chat box. I'll read it out to Dr. Michael. Dr. Michael, my first question is there a cure for breast cancer?
Right. So when we talk about cure means it goes and then it never comes back again. So right now we talk more of remission. So then it means we have taken away the breast cancer and then any focus of affectation. And then we have a period of survival, 10 years, 20 years. And during this period of survival, nothing happens. You virtually can say that you're in remission, or loosely you can say that you have cure. You've achieved cure. But then cure, we would reserve it for these things like maybe malaria. You can get cured for malaria until you are bitten and then get exposed to the plasmodium parasite again. But for cancer, we want to say that you have gone into remission, then means you don't have the symptoms of the cancer anymore after treatment, and then you're living a cancer-free life of sorts. So then that's what it is. So there's treatment that can help you achieve that remission. All right. So there's treatment to achieve remission. And once it is found early, the breast can be saved. I mean, the breast tissue itself, you won't have to take off the whole breast. The breast can be saved, and then you can have an improved overall survival, especially if it's found early.
All right, thank you very much. My next question is, if you have any question, please at this point feel free put in the chat box or in the comment section. I'll read it out to Dr. Michael and he will answer you. Now, Dr. Michael, when you were showing us the anatomy of the breast, you said the breast is made up of fat tissue. Would you say that those who have big breasts have a higher chance or higher risk of developing breast problems?
All right, so the fat in the breast it serves more of a supportive role for the breast tissue. Now you see this thing here. These are the breast tissue proper, and it is in these things that the breast cancer develops, not the fat itself. So then, if you have breast cancer, it usually comes from these ones, not the fat. So it doesn't necessarily mean those with larger breast volumes have an increased risk of developing breast cancer. What it means is that if you have larger breast volume, if there's a small lump, it may be difficult to find because then the other things would overshadow it. You get it? More than somebody who has a smaller breast volume, then any small thing, it will be popping out of the skin. It also doesn't mean that, and another thing too is an advantage for larger breast volume too is that it's easier to conserve breast. So like somebody with capsize E or F or double D compared to somebody with capsize A, if there's a lesion in the breast, it will be easier to take some and then have some left to reconstruct the breast than somebody who has a much smaller breast. That one, you take away the lump and virtually all the breast is gone. So it becomes much difficult to leave some behind. So then, point is, larger breast tissue doesn't necessarily mean bigger risk for breast cancer. It also it also means that it may be difficult to find a small lump if you have if you have larger breast volume, and it is also very it becomes very important, or it becomes very beneficial if you have a large breast mass and then you are going to have a breast conserving procedure. That way you can take some off and then you still have an appreciable amount to still to still reconstruct and have very good looking breasts.
All right, there's another question in the chat. Please, if you have any question, feel free to put it in the chat box or in the comment section. I will read it out. Dr. Michael will answer. Doc, the next question is fibroadenoma cancer?
All right, so I said earlier, of the ones that are not cancers, a fibroadenoma is not a cancer. It is one of the benign ones, and it falls over here. These abbreviations, the long the long form is aberrations of normal development and evolution. Now, a fibroadenoma is an aberration of normal development. All right, so then you find this lump, and usually firm and rubbery and very well outlined. It is not cancer. Most of the time, it doesn't degenerate into a cancer, and depending on the size, it can actually disappear, really, or it can stay the same, or it can grow a bit bigger. But most of the time, people want to take it out just so that they have peace of mind, and it's fair enough. It is not cancer. Fibroadenoma is not cancer, and most of the time, or most of it doesn't lead to cancer. All right, it is not a cancer and doesn't lead to cancer. It is a benign lesion.
All right, Dr. Michael, the next question is it's all over social media, so we need to hear this from the expert. Does breast sucking prevent breast cancer?
All right, so the thing about breast suckling, and not just breast suckling, and fondling of the breast, holding the breast, touching the breast, handling the breast, the things that may prevent or help protect the breast against cancer is suckling, the one the babies do to get milk. So once there's breast milk coming out of the breast, and then the baby is suckling at it, that is the protective one for the breast. The one the man puts his mouth to it and fondles for sexual pleasure will not prevent breast cancer, or will not prevent breast cancer, but it has its positive effect. The more the partner does it, the more he appreciates the normal architecture of your breast, So if I'm handling this breast all the time, and then today I'm handling it and I feel something, well, then it is easier to detect something in the breast if you handle it regularly, if you handle the same breast regularly. So it's more of early detection with handling than prevention of breast cancer with the handling or the sucking. So if you are handling the breast, and it's consistently the same kind of breast you are always handling, you get used to the normal architecture, so that if there's any difference, you can pick it up easily. All right. So father or man handling breast does not prevent breast cancer, but it improves your detection of the breast changes if there are any. All right.
All right, thank you very much. There's a very long question. I'm going to read it out. Please, in case I'm a young lady and I'm not breastfeeding or have never given birth before, pertaining to the breastfeeding to prevent breast cancer, is there any way, such as allowing my breast to be sucked by my husband in order to prevent breast cancer? That has just been answered. Please, I also want to know if the medication that you have shown to us on the screen be duly prescribed in our health certainty. So the first part of the question has been answered. The second part, Dr. Michael made it clear that it's a supplement which is not used in breast cancer. It is used for prevention purposes to counter the oxidative stress, to counter the toxins in our system. I'm not sure. Charlotte Sacre, if your question is answered, breast sucking by adults do not prevent breast cancer necessarily. He said it increases the chances of your partner to detect any unusual texture or lump inside earlier. All right. And then there's another question. Is irregular menstruation an indication that one is predisposed to cancer?
All right. So irregular menstruation will presuppose that there are certain hormonal issues going on, and not necessarily mean that you have an increased risk of cancer. Just means that maybe there are some hormonal imbalances here and there. and it's important to get it checked. Or maybe there could be something in the menstrual tract. So the from the ovaries down to the tubes to the womb or uterus, which is shed. There probably could be something over there that is causing the problems. It could be a fibroid or anything. You get it. It doesn't necessarily mean that you have an increased risk of getting breast cancer. What it also means is that you should get your hormones checked and get it properly evaluated, so that if there are any things that need to be done, they are done for you. All right.
All right, thank you very much. For those of us who joined us late, please, I'm sharing the link, the YouTube link. The recording will be posted on the YouTube link. Feel free to watch the replay of the whole lecture that Dr. Michael gave us, so you understand all that there is to know about the breast. There is a lot to know about the breast. All right. Okay, there's another question from Charlotte. He said, please, why is breast cancer mostly common among young ladies nowadays?
Okay, so still the majority of cancer we see it's more in the older age groups. Then again, we've seen younger ones coming, and it is not an increasing trend of younger people getting cancer. Now, even if it is, one of the reasons that may account for it is improved detection techniques. So instead of being there and then dying for something that we do not know about, or dying from something, maybe a complication of spread, usually, then usually that's usually what happens. Before these sophisticated modes of detection came, it doesn't really mean that young ladies are getting cancers. Well, fine, some are, but not. It is not anything out of the ordinary. Most of the cancers that we still see are in a much older age group, and if a young person gets it, maybe there's either some genetic aberration going on, or there's some family history of the cancer. And quite a number of times, usually you cannot pinpoint any risk factor at all. But then again, like I said, most of the people that we see are in a much older age group. Even though we still see some younger ones, and all because it is now easier to detect very, very early cancer. So something that would have taken a longer time to detect, you see it early, and then maybe they become a part of the statistics.
All right, thank you very much. Another question is it likely for new growth after removal in case of fibroadenoma?
All right, so it's possible that you can have a new growth elsewhere, elsewhere in the same breast or elsewhere in another breast. Yes, it's possible, but most of the time, whatever is there is there. If it's one, it is one. If it's two, and then they get removed. Now, a number of times, what gets confused with a fibroadenoma is a fibrocystic disease. So then you have multiple small cysts. So then you think you have a lot of fibroadenoma in your breast. So then you remove two or three, and then by the time you realize, then there's another two or three in another part of the same breast. Now, those ones, the lumpy breast, those ones are not candidates for removal, because if you chase it, you take off the entire breast. I mean, they are a normal variant of the normal breast, the fibrocystic disease. Those women with the lumpy breast. So then you find small lumps. But then the fibroadenoma, they are usually solitary. If you find multiple, maybe two or three, you rarely find more than five or more than three in a single breast. But you can have a fibroadenoma in both breasts, one on each side, or two or one, I mean, in various proportions. But once you've taken it out, It probably may not come back. Most of the time, it doesn't. Most of the time, it doesn't.
All right, thank you very much. Dr. Michael, I have a question. In this day and age, a lot of ladies going for silicone, breast enhancement surgeries. What's your comment on that?
All right. So breast enhancement. So the silicone, most of the time, it's placed under the muscle here. Under the muscle here. It is not here. And then there's also one that is placed beneath the fat layer. But most of the implants are placed under the muscle, erythromuscular sort of implant to give shape and enhancement, augmentation to the breast. It hasn't really been shown that it increases your risk for breast cancer. It hasn't been shown. I mean, for what it's worth, I mean, if you don't have any reason for breast reconstruction or for any need for an implant, I mean, why get it? It's a foreign body anyway. And foreign body also has its own complications. It can rupture, it can burst, it can get infected. You can have things forming around it, all those things. But then again, it also gives you improved aesthetic appearance. It makes your breast look fuller and whatnot. And possibly another advantage too is that because of where it is and where it's located, it can push your breast out so that if there's any lump or lesion, it is easier to even see or palpate. But by and large, it doesn't really have any, or it has not been shown to have any direct correlation with breast cancers. If the person is going to have a breast cancer, silicone or not, the person may have it, and silicone or not, if the person will not have the cancer, the person usually won't have the cancer.
All right, thank you very much. If anybody has any question, please put in the chat box or in the comment section. Last question, Dr. Michael. This age of sex change and all that, there are genetic males who take certain hormones to become more feminine. Would you say, because we know breast cancer can happen in both male and female genetically, would you say that it can predispose you to developing breast cancer?
Yes, I very much agree with you. I mean, anytime you expose yourself to the hormones, you increase your risk all the time that the hormones are there, or the breast is exposed to the hormones. And male or female, the more these hormones are interacting with the breast tissue, the more the risk increases. So if you are taking hormones, estrogen or whatever, to look more feminine, I mean, it increases your risk as it is, because you're exposing your body to the hormones that sort of feed the cancer. So it is a recognized risk. Hormone therapy, it's a recognized risk factor for breast cancer. So whether you are taking it because of a transgender purpose, or whether you're taking it for whatever reason, just because you are exposing yourself or your breast tissue to the hormones, you're increasing your risk of the cancer.
All right, thank you very much. For those of us who joined us late, the YouTube link has been posted in the Zoom chat box. Please feel free. You can subscribe. When the recording is posted, you can go back and watch it. And of course, there are other recordings of the previous experts that we've had on certain other very interesting topics as well. If there are no more questions, I want to say a big thank you to specialist surgeon Dr. Michael Kwaponyako for spending quite some time with us, letting us know there is a lot to know about the breast, and of course, making us understand clearly from the experts that an adult sucking a female breast does not necessarily reduce breast cancer, but just increases the chance of detecting any unusual texture or whatsoever to prompt the person to seek help. Thank you very much. And of course, to every one of you who made time to join us, I appreciate you all. Thank you very much. Share the word, share the YouTube link, get your friends to subscribe, put the notification buttons on. Anytime anybody asks you any question pertaining to any of the topics that we've discussed, you can just point them to the YouTube channel. They go and watch for themselves. And if they have any questions, they can always ask in the YouTube comment section, I will respond together with the experts who have been featured. Once again, thank you very much. It's once again been a plum pleasing pleasure serving you all. Let's all enjoy our evening, morning, afternoon, depending on where and when you are reaching us. Thank you very much.